Hello, everybody. Hope you all are fine. The topic under discussion today is the coronary circulation and its relevance. This topic has been divided into two parts. So, at the end of part one, the participant should be able to give a brief review of the surface features and the conducting system of the heart. Describe the coronary circulation and give general features of the coronary arteries. Describe the coronary arteries as regard their origin, course, branches, and their area of supply. And towards the end, the participant should be able to summarize the arterial supply of the heart. In part 2, we will discuss the coronary anastomosis, coronary dominance, and venous drainage of heart. At the same time, the participant should be able to summarize the blood supply of heart, that is arterial and venous, towards the end of the lecture. And we will also correlate some of the clinical aspects such as coronary heart disease and investigations for it, coronary angioplasty, and treatment of coronary heart disease, that is stenting, coronary angioplasty, and coronary bypass surgery. We start with the basic considerations relating blood supply of the heart. First, the grooves in which the vessels travel. First one is the coronary sulcus or atrioventricular groove, which lies between the two atria and two ventricles and is considered anterior and posterior. Second is the interventricular groove, which is present between the two ventricles and is again anterior and posterior. Third one is the interatrial groove, which lies between the two atria. It is again divided into anterior and posterior. The crux of the heart, which is indicated by red circles, is the meeting point between the interatrial groove, posterior atrioventricular groove, and posterior interventricular groove. Now, the conducting system of the heart, which consists of number one, sinoatrial node, which is the pacemaker of the heart, is horseshoe-shaped structure located in the atriocaval junction in upper part of the sulcus terminalis. It can generate impulses at the rate of 70 per minute. Second is the internodal conduction pathways, divided into anterior, middle, and posterior tracts which connect the sinoatrial node with the atrioventricular node. Next is the atrioventricular node. It is located in low dorsal part of the interatrial septum and can generate impulses between 50 and 60 per minute. Next is the atrioventricular bundle, which travels from the atrioventricular node through the interatrial wall and is divided into right bundle branch for right ventricle and left bundle branch for left ventricle. Start with the general features of the coronary circulation. Coronary circulation is part of the systemic circulation which carries blood to and from the tissues of the heart. It receives 5% of the resting cardiac output. Heart muscles consume as much oxygen as does equal mass of skeletal muscle during vigorous exercise. Heart tissues extract maximal amount of oxygen at rest. Only way to increase blood supply to the heart is by increasing the blood flow. The blood supply to the heart is relatively stable between 70 to 150 millimeter of mercury blood pressure. The arterial supply is through two arteries, right coronary artery and left coronary artery. And the venous drainage is either indirectly through coronary sinus and its tributaries, or directly through anterior cardiac veins and vena cordis minimi. As regard the general features of the coronary arteries, these arteries are considered to be vasa vasoria as they originate from the aortic sinuses. Blood through these arteries flows during diastole of the heart, and the diameter of the coronary arteries varies from 1.5 to 2.5 millimeters. Left coronary artery is larger in diameter and supplies more heart tissue. These are functional end arteries, that is, their anastomosis cannot compensate if there is sudden blockage. The origin of the posterior interventricular artery determines the dominance of the artery. Sympathetic stimulation dilates the muscular arteries and constrict the epicardial arteries. Now we come on to the description of the coronary arteries. First, the right coronary artery. It is the smaller than the left artery and originates from the anterior aortic sinus. It travels between root of the pulmonary trunk and right auricle in the rightward and downward direction in the anterior atrioventricular groove. It winds around inferior margin of the heart and runs backward and leftward in the posterior atrioventricular groove. It ends by anastomosing with the circumflex branch of left coronary artery at the apex of the heart in 60 to 70% of the cases. As regard the branches, number one, atrial branches are anterior, posterior, and lateral branches to the right atrium. In addition, a sinoatrial nodal branch in 60 to 70% of the cases is given. Number two, right conus branch, which forms an arterial circus, which is named as annulus of Wissens, with a similar branch from left coronary artery at the conus arteriosus of right ventricle. Third are the ventricular branches. These are anterior on the costal surface and posterior on the diaphragmatic surface to the right ventricle. Number fourth, the right marginal branch, which is the largest branch of the right coronary artery. It runs along the inferior border up to the apex of the heart. Fifth is the posterior interventricular branch. which is actually the continuation of the right coronary artery at the crux. It travels in the posterior interventricular groove and gives branches to adjacent parts of right and left ventricle. Number two, septal branches to the posterior one-third of the septum. Number three, an atrioventricular nodal branch in 70 to 80% of the cases. And in the end, it ends at or near apex of the heart by anastomosing with branches of the anterior interventricular artery. The left coronary artery. It is larger than right coronary artery and originate from left posterior aortic sinus. It travels leftward behind pulmonary trunk and emerges between pulmonary trunk and left auricle in left anterior atrioventricular groove. Its length is up to 20 millimeter or 2 centimeter, and it bifurcates at upper end of anterior interventricular groove or sulcus into number one, anterior interventricular artery, which is also named as left anterior descending artery, travels in the anterior interventricular groove beyond the apex of the heart and ends at or near apex of the heart by anastomosing with branches of the posterior interventricular artery. Its branches are number one, multiple anterior ventricular branches to both the ventricles. Number two, diagonal branch to the left ventricle. Number three, septal branches to the anterior two-thirds of the septum. Number four, left conus artery, which makes an arterial circle with an artery from the right coronary artery. Second terminal branch of the left coronary artery is circumflex branch or artery. It runs in the anterior atrioventricular groove, curves around left border, and travels in the posterior atrioventricular groove. It terminates by anastomosing with right coronary artery at crux of the heart. Its branches are number one, anterior, posterior, and lateral branches to the atria. Ventricular branches are anterior and posterior. It also gives a left marginal artery which travels along the left border up to the apex of the heart. Number fourth is the sinoatrial branch in 30 to 40% of the cases. Number five is posterior interventricular branch in 10% of the cases. And number six, an atrioventricular nodal branch in 10 to 20% of the cases. Now let us summarize the arterial supply of heart. The right coronary artery itself supplies almost whole of the right atrium along with anterior part of left atrium and costal surface of right ventricle except a small strip along the anterior interventricular groove. The right marginal artery of the right coronary supplies the right ventricle along a strip which follows the inferior margin of the heart, including the apex. The posterior interventricular artery, the branch of right coronary, supplies a strip of left ventricle and right ventricle adjoining the posterior interventricular groove. It also supplies posterior one-third of the interventricular septum. Now the left coronary artery itself supplies a small upper posterior part of the left atrium only. Its anterior interventricular branch supplies the costal surface of the left ventricle along the anterior interventricular groove and a strip of right ventricle adjoining anterior interventricular groove. That is, it supplies a strip adjoining the anterior interventricular groove along with anterior two-thirds of the septum. The circumflex branch of the left coronary artery supplies the major posterior aspect of the left atrium. It also supplies the diaphragmatic surface of the left atrium between posterior interventricular and left marginal arteries. The left marginal artery of the circumflex artery supplies a strip of the left ventricle along its left margin, that is left ventricle. The notable point is that sinoatrial and AV nodes both are supplied approximately in 70% of the cases by right coronary artery and about 30% of the cases by left coronary artery. Most of the remaining conducting system of the heart is supplied by right coronary artery except the left bundle branch of His, which is supplied by the left coronary artery. To be continued as part 2 of the topic.